Go.
Hello, my name is Mary Carmen Alvarez.
My name is Diva Patach.
And my name is Brianna Castillo.
And we're doing our presentation on hospital nursing. Nursing roles and different kinds of hospital nurses. So, nursing is a career that has a wide variety of roles. Not only is a nurse supposed to take care of the patients, but they're also supposed to be caregivers, decision makers, communicators, teachers, and last but not least, patient advocates, which means that the nurse represents pretty much whatever the patient is that he or she would like. And then nurses today do not just care for the sick, they also have the opportunity to grow by continuing their education to pursue higher degrees, which means that a nurse not only just needs to stay as an RN while working at a hospital, but they can also continue through school and maybe become a nurse practitioner or specialize in a certain field. And there are different kinds of nurses for those who want to specialize. For example, we have emergency nurses, neonatal, pediatric, OR, and trauma nurses. Development of a hospital nurse. So what you need to become a nurse or an RN, there's a couple paths one can take. For example, you can get started as an LVN, and that is a licensed vocational nurse, which is a program that takes about 18 months to complete. And afterwards you take the NCLEX PN, not the NCLEX RN, and with that you can start to work at the hospital. If not, you can always go into the Associate Degree in Nursing program, which is the ADN program, and it takes 2 years to complete, and with that you also get to take the NCLEX, but you take the NCLEX RN. And then there's also the Bachelor of Science in Nursing, which is the BSN program, which is usually done at a college or university, and it's 4 years. And with that, it allows you to pursue leadership positions at the hospital, and it looks really good on your resume because you graduated from a university with all the requirements that you need. And after doing either the ADN or BSN program, you take the NCLEX RN. And in order to do that, first of all, you have to start by getting your high school diploma, GED, and then applying to nursing school. Job description. So job description is a little bit different than the roles the nurse has to fulfill, because the roles, it's more, I want to say it's a little bigger. The job description is very specific. For example, nurses, they have to do the nursing process, which involves assessing, diagnosing, planning, implementing, and evaluating. So that means once the nurse sees the patient, they will ask them everything, how they feel, and they will get to know them a little bit better. They're also going to try to achieve the patient to get a good communication with them and for the patient to trust the nurse. They also have to help patients and the family of the patients achieve health and prevent disease. And by doing that, you're educating them, so you're telling the patient, let's say, for example, what they need to eat in order to get better, or how much they need to exercise in order to provide a good diagnosing plan and to implement it well. And then they perform physical exams and diagnostic tests. They also administer medications, document information such as vital signs, supervise other healthcare professionals that are less skilled, which means that they don't have as high of a degree, and then they educate patients and their families about the risks and also the benefits of having certain procedures and also of certain diseases.
So the salaries of hospital nursing, from the examples given earlier. So just in general, an RN going into the hospital, they would earn about $58,000 per year. And emergency nurses would range from $54,000 to $82,000. And the average for an emergency nurse is about 68. And neonatal nurses is 60,000 to 121,000. Pediatric nurses is 38,000 to 183,000, and OR nurses are 56,000 to 84,000. And the more education and experience you have will allow you to have a higher income. So the national certification, the NACCE, the national certification to become an RN, you would have to take the NCLEX, which is the National Council Licensure Exam, and the NCLEX is basically the state board exam for nurses. And to obtain a position in a specific field, you would have to go through more education and experience. You would first receive your bachelor's degree, and then move on to getting your MSN. And following that would be your PhD or DNP. An example of how to achieve a higher position for, let's say, an OR nurse would be to earn a bachelor's degree in nursing, then to obtain your RN license and get clinical experience as well as OR experience, then seek to take the CNOR exam. So advantages of hospital nursing would be, well, first, the positive impact. You're helping the patient get better, as well as possibly saving their life. Two would be it's diverse and interesting, so nurses never see the same thing every day. There's various patients, and it's always exciting. Number three is teamwork. So working with other nurses and other patients, you're working with several other people and several other personalities, which can cause a challenge because there's some people who may be moody or not moody, but this will help you overcome these obstacles and you gain skills to become a better nurse. Also, there's strong job stability, which is good because nursing is a trusting profession, and the need for medical attention is increasing because of the elderly, and everyone needs medical attention.
So with advantages, there are also disadvantages, and in the hospital setting, you are at risk for getting a viral infection or like the flu or anything the patient may have that he or she may give to you, which puts you at high risk. And there also, when you're a nurse, there are unreliable schedules, so oftentimes you won't have, you'll have a start time but you won't have an end time. It's not like a 9-to-5 job where you just come in, do your work and leave. Oftentimes the other nurse that's coming in to take your position won't show up, or the hospital gets a lot of patients and you have to stay. And then there are also emotional impacts. You do help the patients get better, but oftentimes you will have to see your patients struggle, and sometimes that may lead to death. There are also demanding patients, so the patients who come into the hospital are sick and have an illness that may not be curable, so they'll take out their anger on you because they don't have anyone else to really take it out on. So you may run into grumpy patients. So the Nurse Practice Act is the California law mandates the board to set outcome and scope of practice and responsibility for RNs. So there's a board that has specialized RNs, and they set out the laws and guidelines that an RN has to follow. And so you can find that the Nurse Practice Act in the California Business and Professions Code, and SART to 2700. There's a website. And the NPA puts together, so I said that the NPA puts together a group of board members, and they make all the administrative rules, and then patients rely and trust the nurses, so we need to have basic guidelines because they're trusting you with their lives, and the NPA allows them to do so by not allowing unprofessionalism or unsafe practice. And that completes our presentations.
Hospital nursing.